Hello guys, welcome back, and in this video lecture we are going to talk about non-steroidal anti-inflammatory drugs which are known as NSAIDs or NSAIDs. These are commonly used analgesics and in the body we have phospholipids which forms arachidonic acid by the enzyme PLPA2. And then this arachidonic acid is metabolized by two pathways, either by cyclooxygenase pathway or by lipoxygenase pathway. If it metabolized by cyclooxygenase pathway, it gives prostaglandins, and via the lipoxygenase pathway, it forms leukotrienes. Then these prostaglandins, we have different type like thromboxane A2, which act on platelets, or prostaglandin I2, which act on endothelium, and prostaglandin D2, E2 or F2, which act on the other system. So steroids inhibit this conversion of prostaglandin to arachidonic acid, and NSAID, non-inflammatory, non-steroidal anti-inflammatory drugs, NSAIDs, act by inhibiting the cyclooxygenase pathway. So this pathway is inhibited by NSAIDs, non-steroidal anti-inflammatory drugs. So non-steroidal anti-inflammatory drugs, NSAIDs, inhibits the cyclooxygenase enzyme, and therefore prostaglandin synthesis is inhibited. This prostaglandin synthesis is responsible for fever, pain, inflammation, and therefore by inhibiting the cyclooxygenase pathway, by inhibiting the cyclooxygenase enzyme, we can in turn reduce the pain in the individual. This is how NSAIDs works or NSAIDs work. It acts as the analgesics. I told you it acts by relieving pain. So we have two different type of COX enzymes. I told you NSAID inhibit the COX enzyme, cyclooxygenase enzyme. COX enzyme is of two type, COX-1 and COX-2 enzyme. By inhibiting the COX-1, inhibition of the COX-1 by NSAIDs can cause gastritis, bleeding, and analgesic nephropathy if NSAIDs are used for a long period of time. See, if you inhibit this COX-1 with the help of NSAID, it can cause various things like gastritis, or there can be bleeding or analgesic nephropathy if it is used for a long time. If you inhibit COX-2, it is used for treating pain, fever, and inflammation. So majorly we use COX-2 inhibitors for reducing fever, pain, and inflammation. COX-1 is a constitutive enzyme. COX-2 is an inducible enzyme. So COX-1 inducible at the site of inflammation, and the normal sites of COX-2 are kidney, endothelium, and central nervous system. So what are the different type of pain and the treatment that you can give? If it is a musculoskeletal pain, that means pain related to muscle and the bones, then you can give NSAIDs, which is non-steroidal anti-inflammatory drugs. If it is cancer related pain, then we give opioids to relieve the pain. Or if it is a neuropathic pain, that means it is nerve related, origin is nerve, neuropathic pain, you can give pregabalin, gabapentin, carbamazepine, or amitriptyline. All these drugs can be given for neuropathic pain. Now remember, if the pain is musculoskeletal, then you can also relieve pain with the help of NSAIDs. So let's classify NSAIDs. So classification is classified into majorly three groups. One is non-selective COX inhibitors. That means they are not selective. They are not one or two. So they act on inhibition, COX-1 and COX-2 both. They are not selective. Second one is preferentially COX-2. That means these prefer to inhibit COX-2 preferentially, as the name suggests. Preferential COX-2 inhibitors. And I told you COX-2 act by inhibiting by treating pain, fever, and inflammation, and that is why specifically we are focusing more on COX-2. Third one is selective COX-2. They selectively inhibit the COX-2. So coming to the first one, non-selective COX inhibitors. Non-selective COX inhibitors, the first category, non-selective COX inhibitor, they inhibit both COX-1 and COX-2. Cox inhibitors. They inhibit both Cox-1 and Cox-2. And Cox enzyme can be inhibited either by reversible process or by irreversible process. See, it is inhibiting the Cox-2, but it can be either reversible or irreversible. So another can be, it can be either reversible or irreversible. First, we will talk about irreversible. The one in which inhibition is irreversible. That means you cannot go back again. So non-selective irreversible Cox inhibitor is aspirin. Very important drug, aspirin, and the mnemonic to remember aspirin is in the name itself, aspirin. So if you break down the name, A for it has got antiplatelet action, antiplatelet properties. Then S is saturation kinetics. P is it prevents colon cancer and preeclampsia. So prevents colon cancer and preeclampsia. Preeclampsia is given in case of a pregnant woman who is hypertensive, and it increases the chances of miscarriage or early labor, and that is why we need to give aspirin to these high risk pregnancy patients. Then I is, it is irreversible Cox inhibitor. I told you it is irreversible. It inhibits the Cox, both 1 and 2, irreversibly. Irreversible. R, it causes Rey syndrome. And I is iron tapping. It causes iron tapping. And N is nephropathy. N is nephropathy. So you can remember from the word aspirin itself. So if you start with the A, in the aspirin it has antiplatelet. It is also antipyretic, anti-inflammatory and anti-analgesic properties. So these are the properties of aspirin. So aspirin has antiplatelet properties. When a low dose of aspirin is given, it inhibits the Cox enzyme in the platelets, and this will lead to decrease in thromboxane A2, and thromboxane A2 as the inhibition is irreversible. So this decrease in thromboxane A2 eventually decreases the platelet aggregation. I told you the function of thromboxane is related to aggregation of the platelets, and therefore aspirin acts as antiplatelet drug because it inhibits the Cox irreversibly. So aspirin is also a drug of choice for rheumatic fever. Coming to S, saturation kinetics. When a normal dose of aspirin is given, then it follows first order kinetics. This we have covered in the journal Pharmacology also. When a high dose of aspirin is given, then it follows the zero order kinetics. So also S, you can remember salicylate poisoning. That is the poisoning of aspirin, also known as salicylate poisoning. So salicylate poisoning is aspirin poisoning, guys. It is aspirin poisoning. So you have to, if a person has consumed aspirin, a lot of aspirin tablets, so in that case you have to maintain airway, breathing, circulation, and you should do the gastric lavage so that all the medicines that the person has taken should come out through the vomiting. And aspirin C is an acid, right? And there is, so no antidote can be given. So therefore, because it is an acid, we give bicarbonates, sodium bicarb. So we give bicarbonates to treat the metabolic acidosis. But at last, if you are not able to treat this aspirin salicylate poisoning or aspirin poisoning, you can do hemodialysis to remove the salicylate from the body. So aspirin poisoning, also known as salicylate poisoning, and in the exam they can also ask about the drug that you can give it as sodium bicarbonate or bicarbonates are given. Now coming to P, it prevents the colon cancer and preeclampsia. Also from P, you can remember it prolongs the bleeding time. I told you it acts as the antiplatelet. So because it is acting as antiplatelet, therefore there will be elongation of the bleeding time, BT. It is an irreversible Cox inhibitor and it causes Rey syndrome. So it causes encephalopathy and liver damage. So this syndrome is commonly seen in children less than 12 years of age who are under aspirin medication for viral fever. Like say influenza, you have given aspirin. So it is most commonly seen in less than 12 years of children. It causes iron tapping. See, I told you it is an acidic drug. So when it moves into a cell with a pH of 6.7 to 7, aspirin get ionized, and following aspirin is trapped inside the cell, and therefore it causes gastritis also. So nowadays we have aspirin that is coated with the coatings there to prevent the gastritis component, but aspirin causes gastritis. That is again one of the drawbacks of taking aspirin, and it can cause analgesic nephropathy, and it can also cause papillary necrosis. So this is the drawback, and these are the things that you need to remember regarding aspirin, and you can remember from the mnemonic, that is aspirin itself. So aspirin is irreversible COX inhibitor. Now coming to non-selective reversible COX inhibitor. The first category is non-selective COX inhibitor, right? We are talking about both 1 and 2. So non-selective COX inhibitor, we have already discussed about irreversible. Now we'll talk about reversible non-selective COX inhibitor. In the reversible non-selective COX inhibitor, we have drug like indomethacin. So indomethacin decreases the neutrophil chemotaxis. It has got additional anti-inflammatory property by reducing the neutrophil chemotaxis. That is why it is used to treat diseases like osteoarthritis, rheumatoid arthritis, and gout. Also, indomethacin can be used to close the patent ductus arteriosus, so PDA. But it has got a severe adverse effect and side effect, that is it can cause psychosis. It can also cause frontal headache, severe frontal headache, psychosis, or hallucination, or patient can also develop suicidal tendencies if indomethacin taken for a long period of time. Therefore, we do not give indomethacin in patient with either epilepsy or depression or psychotic patient. We do not give indomethacin because it will further enhance their psychotic issues. So coming to the second drug, that is reversible, we are talking about non-selective reversible COX inhibitor. So here this inhibition is a reversible inhibition. The second one is ibuprofen. Ibuprofen is used as an analgesic in children. So it is basically the analgesic of choice in children. So if they ask you analgesic of choice in children, it is ibuprofen, and it is used to close patent ductus arteriosus, PDA, which we have discussed in the medicine section also, and that when you are studying about general medicine, in the cardiology section you will study about patent ductus arteriosus. So this is basically a cardiac illness. Coming to the third reversible non-selective reversible COX inhibitor, it is mefenamic acid. Mefenamic acid is heard by all the girls because it is a tablet that is taken during the menstruation pain. So it has got basically this mefenamic acid, why we use it for menstruation pain is that it gets concentrated in the uterus, and it decreases the prostaglandin activity. So it is also antipyretic property, but it is used to treat dysmenorrhea also. That is what the bleeding or the menstruation issues, we use the mefenamic acid because it gets concentrated in the uterus, and it decreases the prostaglandin activity. Coming to the fourth one, which is paracetamol. Very important drug, guys. All of us must have taken at least once in the lifetime, paracetamol, which is also known as acetaminophen. Paracetamol or acetaminophen is a good analgesic. Remember this thing. It is a good analgesic, good antipyretic, and that is why we use it for fever, right? Pyretic means that it reduces the fever. Antipyretic means it reduces fever. Pyretic means fever. So it has got good analgesic and good antipyretic property because it inhibits the COX-3 in hypothalamus. However, it has got a poor anti-inflammatory property, but we have poor anti-inflammatory property. Anti-inflammation property is poor when it comes to paracetamol. So poor anti-inflammatory property, poor anti-inflammatory drug, and the proposed theory that says that it has got a poor anti-inflammatory property is the peroxide theory. So peroxides in the body will not allow the drug to inhibit COX, and that is why the anti-inflammatory property is poor for paracetamol or acetaminophen. So paracetamol or acetaminophen is given in children. It is given in bronchial asthma. It is the safest analgesic in chronic kidney disease. It is the analgesic of choice in osteoarthritis. Also, it is safe in pregnancy. Safest drug. The safest drug that is known is paracetamol. So you can give paracetamol in any condition, either in pregnancy, lactation, CKD, kidney disease, chronic kidney disease. So basically it is the safest drug that is known. But what if there is a PCM overdose? Now, this kind of thing is seen in young adults because paracetamol is commonly available at the home. And the person who, suppose if a child has failed in some exam and he is not getting anything with the suicidal thought to take up, right? So or if a person if a child, teenage, has gone through breakup, so he takes a lot of paracetamol. So we see paracetamol overdose in a lot of clinical practice. If there is a paracetamol overdose, then the antidote that we give is N-acetylcysteine. This is the antidote that we give to paracetamol poisoning. Coming to the next reversible non-selective COX inhibitor, it is ketorolac. Ketorolac is very important in dentistry also because we give after implants. After you place implants, the pain after implant cannot be subsided with the paracetamol. So we give ketorolac to these individuals who are in severe pain. So basically ketorolac we give in tablet form, but it was also in IV form also. So you can also give via parenteral route. But we give a tablet of ketorolac which is placed in the water like Aspirin, and it get dissolved, and we ask the patient to have it. So ketorolac is used for treating post-operative pain. Post-operative pain is so severe and it is treated with ketorolac, also available as eye drops in the market. Coming to next non-selective reversible COX inhibitor, it is nabumetone. Nabumetone is a pro-drug for osteoarthritis. Then piroxicam. Piroxicam is the longest acting NSAID. It is the longest acting NSAID. It acts for a long duration of time. It undergoes a process of enterohepatic recycling, and that is the reason, because it recycles, that is the reason it is considered as the longest acting. Then the last one in the non-selective reversible COX inhibitor category is phenylbutazone. It suppresses the bone marrow. So these are the non-selective COX inhibitors. In irreversible, we have studied about aspirin, and in the reversible section, we have studied about indomethacin, ibuprofen, mefenamic acid, paracetamol, which is also known as acetaminophen, or ketorolac, or nabumetone, or piroxicam, or phenylbutazone. These are the reversible non-selective COX inhibitor. Now coming to another section, that is another category, which is preferential Cox-2 inhibitor. Why I say preferential Cox-2 inhibitor? Because it inhibits Cox-2 more than Cox-1. So they they are preferred. So they prefer to be Cox-2 inhibitor. They prefer to be Cox-2 inhibitor. That is why we call it preferential Cox-2. So you can remember these drugs via the mnemonic, that is amend the preference. Amend the preference. So the preference, you can remember, it is a preferential Cox-2. And from amend you can remember A for acylophenec. M is meloxicam. Then E is etodolac. N, we have two drugs. One is nabumetone. Nabumetone is also non-selective, irreversible. But here we are going to remember the most important being nimesulide. And D is diclofenac or diclofenac. So aceclofenac, diclofenac, and meloxicam, etodolac or nimesulide, these are the drugs that are preferentially Cox-2. Why I say preferentially Cox-2? Because they inhibit Cox-2, they block the Cox-2 preferentially than the Cox-1. So they are intermediate between non-selective and selective, because they are inhibiting both, but they are inhibiting more Cox-2 than Cox-1, but inhibiting both, but more Cox-2. So they are intermediate between non-selective and selective Cox-2. The advantage of this inhibitors is that it may lower the risk of gastritis. And if you remember, gastritis is something that is seen with aspirin more. Now coming to selective Cox-2. As the name suggests, selective Cox-2 means they are inhibiting selectively only the Cox-2. So they are inhibiting only the Cox-2. These inhibitors selectively inhibits the Cox-2. So chances of gastritis are minimal for this. And these are the drugs that end with Cox-Sib. So Cox, you can remember. Cox word means that we are inhibiting the Cox. See, Cox-I inhibiting the Cox. And B, you can remember 2. So these are the drugs that inhibiting only the Cox-2. So B is A is 1 if B is 2. So you can remember Cox-I inhibiting the Cox-2 inhibition. So inhibitor selectively inhibits the Cox-2 inhibitor, and the drug ends with Cox-Sib. For example, Celecoxib, Pericoxib, Etoricoxib, Lumiracoxib, and Rofecoxib. One more, Valdecoxib. See, this Celecoxib is given orally. Now, Pericoxib, as the name suggests, parenteral. Peri from parenteral, you can remember. Pericoxib is given through parenteral route, the IV route. Etoricoxib again given orally, but it is the longest acting, longest acting coxib. And then Lumiracoxib. Lumiracoxib, L for Lumira, and you can remember L for liver toxicity. So withdrawn, this drug is withdrawn, that is because it causes the liver toxicity, due to the liver toxicity. So L for Lumira and L for it causes liver toxicity. Rofecoxib and Valdecoxib are banned because there is increased risk of MI and stroke when both of these drugs are given. Therefore, they are also banned. So Celecoxib, Pericoxib, Etoricoxib, you can remember all of these drugs, and Peri from parenteral. And the drugs end with Coxib are the Cox-2 inhibitor. So these are all the inhibitors that we have talked about. Non-selective Cox inhibitor. Non-selective means they are not selective about Cox-1 inhibition or Cox-2 inhibition. They are inhibiting both of these. Then we have preferential Cox-2. Preferential Cox-2 means they are preferably Cox-2, but they are inhibiting both Cox-1 and Cox-2. Selective Cox-2 means they are selectively inhibiting the Cox-2 only. So this is how you can remember in the name itself. So guys, this lecture is about NSAIDs. All the best.